Artria added to Perth's tech hub status on Friday after soaring on its ASX debut. Not only did Artria raise $40 million at IPO, the AI-based cardiac diagnostic support solution medtech company also recently won a tender to become an artificial intelligence supplier for the NHS in the UK. Joining me today to discuss the success of Artria so far is the Managing Director and co-founder of Artria, John Barrington. John, Artria has made a very successful debut on the ASX. Were you expecting this kind of response to your public listing?
It was successful, Grady, and we're very pleased. No doubt, of course, our shareholders were as well. There was always uncertainty, and of course we came onto the market when Omicron was having an impact on the ASX. However, history would suggest that there's been strong support for the Artria stock in each of the three prior capital raisings, angel, seed, and then the private placement prior to IPO. Each round was oversubscribed, so we were confident there was strong support and interest given the tragic need of 126 million people being afflicted by coronary artery disease in the world, strong support for what Artria is doing.
Well, in a week where the new Omicron variant of COVID-19 was reported, as you mentioned, were you nervous at all at this time that it may have an impact on the Artria debut?
Just a little. We have excellent timing because the information memorandum for our seed round was released on 16th of March 2020. That would be the day the ASX recorded a record fall of 9.7% when COVID first had an impact. At that seed round, we were seeking $2 million and we were successful in garnering $2.8 million in that capital raising. So going into this one, there is always uncertainty, but the IPO capital raising, we were seeking $40 million. It was well oversubscribed. So we were confident. Again, there's strong support for what Artria is doing.
Now, you raised $40 million at IPO. What will these funds be primarily used for?
Continuing product development. We've got a 3-year product runway to develop further innovative and I might say world-leading artificial intelligence, deep learning products. Also our clinical research and development work, which is very important. We have an extensive clinical research and publication program, and the regulatory approval that is required, of course. We have the initial regulatory approval in Australia with the Therapeutic Goods Administration. We've applied for FDA in the United States, Health Canada, CE mark in Europe, and UK conformity assessment. And so managing those regulatory processes is the second area. Of course, our sales and marketing, and I can elaborate on that a little further, and then the continuing corporate management. So they're the key areas that we're focusing on.
Well, you recently won a big tender contract to become a provider of AI for the National Health Services in the UK. What was involved in this tender process and how big of a win was this for Artria?
It's a significant win. It was a global tender let by the National Health Service in the United Kingdom earlier in 2021. We applied along with major players and global companies. We were successful in being appointed to a 2+2 year, so 4-year framework agreement panel contract. There are 10 other companies on that contract, but the Artria Salix product is the only product that's providing the capabilities that the Salix artificial intelligence offering provides. So it's a wonderful opportunity for us. It provides direct access into 1,250 NHS trust hospitals throughout the United Kingdom, and as I said, it is a strong testament to the capability of the Artria Salix product.
Now, what further expansion plans do you have beyond the NHS in the UK?
We have 3 people now on the ground in the United States. We're looking at setting up research facilities and development facilities in the United States, and of course we'll have sales offices in the US. We have a partnership with world-leading Ottawa Heart Institute in Canada, and we will look to expand through Canada, UK I've spoken of with the NHS and outside the NHS, and of course the other jurisdiction is Europe, and we have applied, as I said, for the CE mark regulatory approval in Europe, and we'll focus in the first instance on the EU4 major countries. There are other jurisdictions globally that we will look to expand into over time in our third strategic horizon.
Now, you mentioned in another interview that you were very fortunate to find the talent in WA to develop this here in our great state. This is huge for WA and a massive success story so far. What benefits did you find whilst building this company in WA?
Well, you've captured it well, Grady. This is very important for Western Australia. Entrepreneurship and innovation is the very fabric of Western Australia, and it is important that we are doing this here. All of the IP owned by the Artria shareholders is and has been developed in Perth, Western Australia. So it's testament to the state that the talent is here, and we're continuing to employ people. We have over 30 in the team now. Given we've developed and now piloting a world-class product, it's demonstrable that we have a world-class team all assembled here in Perth, Western Australia. So the benefits for us are we have the opportunity to work alongside many other organisations and institutes. Harry Perkins Institute of Medical Research is a leading research institute, the University of Western Australia, and other work that's being done in Western Australia really builds the momentum of innovation and entrepreneurship in WA, and we've benefited from being able to find the talent right here.
Well, Artria is definitely a company to watch over the coming months as you continue to soar to great heights of success. Thank you for joining us today, John. We really appreciate your time.
Thank you very much.